The Health Services and Systems Research Program at Duke-NUS was established in 2008. And our vision is to improve the performance of health systems in Singapore and beyond through delivery of cutting-edge and pragmatic health services research. We do that by looking at population health outcomes, but also the cost-effectiveness of delivering care, the quality of life of patients, as well as the quality of life for healthcare providers. So in Singapore, we still face major challenges in healthcare, and this includes a rapidly aging population. At HSSR, we are aligned with Singapore's push into population health and integrated care. We believe we can make a difference and improve outcomes.
One of my current projects is to systematically evaluate the Singapore's new front-of-pack beverage label, which is called the NutriGrade. The label itself was implemented by the Singapore Health Promotion Board for helping the consumers to distinguish whether each beverage product is healthier or less healthy. We conducted a randomized control trial using an online grocery store, and what we found is that the NutriGrade helped consumers to choose relatively healthier beverages so that their sugar consumption was reduced.
The big revolution in our time is artificial intelligence. And artificial intelligence has the potential for us to make better sense of our data, make better diagnosis, better treatments, and give decision support to our clinicians.
At my current project, our goal is to build fair AI models to mitigate biases that are embedded in data, as well as biases that are stemming from inappropriate modeling process. For this project, we closely collaborate with clinicians from SGH in emergency department. For example, we can provide data-driven clinical scores to help them to do the decision-making. I chose to pursue a PhD program in HSSR because I always be very enthusiastic about technology, and I wanted to do something make real impact on patients by integrating technology into healthcare practice.
So here at HSSR, we have different levels of education programs. We have a very successful PhD program where we are actually training our researchers. We also have a graduate certificate program, which is equipping adult learners with a healthcare background. And finally, we provide support for the medical school and the medical students such that they have an introduction to health services research before they actually begin their clinical practice. We want to take the opportunity to thank all our partners that work very closely with us in HSSR, both local university partners that work with us, of course our doctors, nurses, allied health partners and clinicians, our industry partners, and of course our supporters, both in the community as well as in society, without whom we will not be able to do a lot of our impactful research. It takes a system to save a life. HSSR fulfills a unique role within the Singapore ecosystem where Duke-NUS is the proponent of using health services research to bring clinicians and researchers together to solve problems in healthcare. My vision for HSSR is that we can use cutting-edge science not just to improve the lives of one patient at a time, but to improve things at a systems level that can impact many thousands or millions of lives in Singapore and beyond.